Chapter 4 will deal with glaucoma treatment, but also with ANS problems. These ANS practice problems actually are fully annotated. You have the full answers and explanation after the problems. However, they're really the ultimate of reviewing the autonomic nervous system. And I really wouldn't like my students to be stuck trying to do these problems by themselves. So we're going to try and work them out together. If I were you, though, watching this video, I would listen to the first couple of them, and then I would press that pause button or even the stop button, and I would try and do them myself once I understand there's a pattern on how to answer, because it would really be critical that you try them by yourself, and then if you're really stuck, then watch the video and see the answers. The portion you must listen to right now is, we've mentioned an awful lot of time, glaucoma. And when I'm looking at glaucoma, there are several autonomic pharmacology ways of dealing with the disease. First, what is glaucoma? It's a disease that comes in two flavors, open angle or closed angle. Now, what angle are we talking about? Someone from England, maybe? No, we're talking about the angle between the iris and the cornea. And when we call it open angle, it means it's a broad opening between the two. Closed angle, it's very narrow. In all situations, glaucoma is defined as an increased intraocular pressure, an increased IOP. And that increased intraocular pressure is an issue. In a closed organ like the eye, it will increase pressure on the vascular supply of the patient's retina, and with hypoxic damage to the retina of very fragile neural tissue, then you could get blindness. That increased intraocular pressure in open-angle glaucoma is a chronic condition which is absolutely painless. And you know, things that are painless, unless we monitor them, certainly the patient is not going to come and tell you, hey doc, I think I have glaucoma. So the whole idea is to measure intraocular pressure, which is done generally every time you go to an ophthalmologist or an optometrist, maybe changing your glasses and so forth. Now, we'll look at the drug treatments in a second, but beta blockers are the classic ones. For closed-angle glaucoma, it can be an acute, painful condition. And when it's an acute condition, what we mean by this is that it's a matter of hours for us to decrease intraocular pressure using powerful diuretics. Otherwise, blindness would be the result. If it's a chronic or genetic condition, then once again, it may not be painful and certainly still require management. Whereas drugs are very much used to manage glaucoma. In some cases, surgery will be relevant, particularly laser surgery or iridectomy. We want to look at drugs in pharmacology. Here's a diagram first showing that iridocorneal angle. And this is where aqueous humor is recirculated. So let's organize ourselves with this diagram. What you're supposed to recognize is a nice section of the eye with here the actual sclera. If it's red like this, you probably smoked too much pot. And here the cornea of the patient. And right behind the cornea, here's the iris. Now, there is the angle in glaucoma between iris and cornea. Right behind the iris is the lens. The lens is held on suspensory ligament, those little strings which I'm repainting in blue, and those suspensory ligaments themselves are held by the ciliary muscle. That ciliary muscle in its entity, that ciliary muscle in its entirety is referred to as the ciliary body. What are receptors I find at these levels? Well, the receptors I'm going to find are beta 1 receptors here, which allow the production of aqueous humor. And if I'm showing you aqueous humor in black as an arrow, it is made at the level of ciliary bodies as an ultrafiltrate of plasma, bathes the posterior chamber of the eye, gets through the pupil into the anterior chamber, and gets recirculated in the angle of the iris and the cornea. This is where you find the canals of Schlemm or trabecular meshwork that just drains that aqueous humor. To have an increased intraocular pressure, you have an imbalance between the rate of production of that humor and the rate of excretion of this humor through the canals of Schlemm. If the angle is narrow, what it means is literally the iris is clumping next to the canals of Schlemm and physically obstructing the aqueous humor's access to those little canalicules. If the angle is broad and open, then your biggest issue is you probably have degenerative changes in those canals, such as fibrosis or genetic changes that make them very tortuous, and you decrease the rate at which it outflows. Well, beta-1 receptors, I can obviously block them and decrease aqueous humor production with eye drops of beta blockers such as timolol. That would decrease aqueous humor production. This is particularly found in open-angle glaucoma. In situation where my iris is clumping into the iridocorneal angle, then the other possibility is to work with muscarinic receptors. Look, there are muscarinic receptors in the ciliary muscle and in the iris muscle. And muscarinic stimulation is going to cause contraction of these muscles. Look at my fingers a second. This is just like your diagram. And as you look at my fingers, the pupil being in the middle, imagine that I'm causing mydriasis. See mydriasis? Look at my finger knuckles now. They would actually be clumping into the angle. Conversely, if I cause meiosis, then I'm opening the angle. I'm leaving room for aqueous humor to outflow. So the whole idea is to give muscarinic agonist to open the angle. And muscarinic agonist with meiotic drugs could be drugs like pilocarpine, direct-acting muscarinic agonist, or which acetylcholine esterase inhibitor that was like an insecticide, but we used it topically in the eye. If you remember the drug Ch04a, then it's absolutely perfect. Those meiotic drugs will improve the aqueous humor outflow. So you have beta blockers to prevent the production, muscarinic agonists to improve the outflow. This is what we summarized for you in this table. Here are pilocarpine and ecothiopate, muscarinic agonist or acetylcholinesterase inhibitor. They improve the outflow of aqueous humor. They basically open the angle. They do similar to what we would do with surgery with iridectomy, but they do it with a drug. Conversely, you have timolol, a beta blocker, which decreases aqueous humor formation. Are these the only drugs we use in glaucoma? Not at all. You'll see later on, we'll talk about the drug latanoprost. Latanoprost, we'll see it when we review actually inflammatory drug because it's a prostaglandin analog. But as a prostaglandin analog, it's a drug that will actually open the canals of Schlemm and improve against the outflow of aqueous humor, just through a different mechanism than autonomic pharmacology. One problem of latanoprost, if you want to write it somewhere in a corner, is that it's going to cause some pigmentation of the iris, a darkening, browning pigmentation of the iris. So that would be a side effect of using eye drops of latanoprost. Otherwise, for the acute, emergent, narrow-angle glaucoma attack, then we need diuretics. And amongst the diuretics, mannitol, and also short-term treatment with carbonic anhydrase inhibitors will be indicated, but we'll see those in the diuretic section. Now a final point about glaucoma. If meiosis is a good idea in glaucoma, then in your margin it tells you something important about drugs that would cause mydriasis. If you're an alpha-1 agonist or a muscarinic blocker, you should be contraindicated in people with glaucoma, particularly the narrow-angle glaucoma. It could precipitate an acute attack and result in blindness.